Sir, good evening, sir.
Go ahead.
Sir, my topic is about three drugs, sir. About Sugammadex, Levosimendon, and Remimezolam, sir. First, we'll talk about Sugammadex, sir. Introduction. Sugammadex is a modified gamma cyclodextrin. This is the first agent which is a completely new class called selectively relaxant binding agents. It is introduced in clinical practice in 2008. The mechanism of action, it works by recapsulating aminosteroid neuromuscular blocking agents, mainly rocuronium and vicronium. Sugammadex has a hydrophilic exterior and lipophilic cavity. Thus, the lipophilic core forms the tight inclusion complex with steroid nucleus of rocuronium and vicronium in 1:1 ratio. Once encapsulated, the plasma is free of the relaxants and the plasma level concentration falls rapidly. This creates gradient. The drugs move from neuromuscular junction back to into plasma, and neuromuscular transmission recovers almost immediately. Unlike neostigmine, Sugammadex does not inhibit acetylcholinesterase, therefore produces no muscarinic side effect like bradycardia, bronchospasm, or salivation. Pharmacokinetics. Route, it is a IV bolus. Onset of action is 1 to 2 minutes. Peak effect around 3 minutes after 2 mg per kg dose. Distribution, it is almost limited to extracellular fluid. Elimination, it is eliminated unchanged in kidneys. Half-life is about 2 hours and it can be prolonged in renal impairment. Dosage, after routine for the routine reversal after the top count of 2, it's 2 mg per kg dose equivalent to neostigmine reversal. In the D block, in the post-tetanic stimulation of course 1 and 2, the dosage is about 4 mg per kg, reliable even in D blockade. Immediate reversal after rapid sequence induction dosage of recurrent 1.2 mg per kg. The dosage, Sugammadex dose is 16 mg per kg. Used in cannot intubate and cannot ventilate situations. Advantages of using this Sugammadex: it has a rapid, predictable, and complete reversible from any depth of block. It has no cholinergic side effects. No need for glycopyrrolate or atropine. It reduces the residual neuromuscular blockade, improving safety in postoperative wards. Allows rapid sequence intubation with recurronium, yet provides immediate reversal option. Safe in elderly and hepatic disease. Adverse effects, sometimes the drug causes bradycardia, which is often severe, which requires atropine or epinephrine. Anaphylaxis or hypersensitive reactions. Recoagulation if inadequate dose or delayed redistribution. Hormonal contraceptive interference is to be found. Transient prolonged PTINR values. Contraindications, it is contraindicated in severe renal failure with a creatinine clearance of less than 30 ml per minute, and known case of hypersensitive to Sugammadex and cyclodextrins. Note, in this drugs are ineffective against benzocaine agents like atracurium and citratracurium. These drugs are costly but beneficial in safety and turnover. It is now preferred drugs as a reversal agents. The second drug we'll discuss about is Levosimendon. Levosimendon is a calcium sensitizer and potassium ATP channel opener. It provides three functions: inotropy, vasodilatation, and cardio protection. Hence, it named as a inodilator. Mechanism of action: first, it acts on calcium sensitization. Levosimendon binds to cardiac troponin C in calcium-dependent manner. This increases the sensitivity of contractile protein to existing calcium. Thus, contractility improves without raising the intracellular calcium. So there is no increase in oxygen demand and no arrhythmogenic effect. Second mechanism of action of this drug is opening of potassium ATP channels. In vascular smooth muscles, it causes vasodilatation. So it leads to decreases the preload and afterload, and it reduces the LV filling pressure. In mitochondria, it improves the ATP synthesis and prevent ischemic injury, providing the cardiac protection. Third, it has also act as an anti-inflammatory and anti-apoptotic drugs are also been described. Pharmacokinetics, it administered only in IV formulation. Onset of action is 5 to 10 minutes. Half-life, the parental compound has 1 hour, and the active metabolite OR1896 has 90 to 80 hours prolonged benefits for 5 to 7 days after 24 hours of infusion. Metabolism, it normally has the hepatic metabolism, and metabolites are excreted through urine and feces. Dosage, the loading dose of 6 to 12 microgram per kg IV over 30 minutes. Maintenance infusion for 0.05 to 0.2 microgram per kg per minute for 24 hours. The effects persists due to its long-acting metabolite. Hemodynamic effects of this Levosimendon, it has a positive inotropic effect. It increases the stroke volume and cardiac output. It causes vasodilatation, which leads to peripheral vascular dilatation. It leads to decreased in preload and afterload. It improves the coronary and renal perfusion. There is no significant tachycardia or oxygen consumption. It improved diastolic relaxation and LV compliance. Uses of this Levosimendon, it used in acute decompensated cardiac failure, especially in low cardiac output patients. It provides in perioperative low cardiac output syndromes after cardiac surgeries, weaning from the cardio or mechanical ventilatory support, bridging therapy before cardiac transplant, investigations in patients of septic cardiomyopathy and right heart failure. Adverse effect, it causes hypotension due to vasodilatation, headache, nausea, dizziness, hypokalemia, and reversible thrombocytopenia, which is rare. Contraindication in using Levosimendon in case of severe hypotension, tachyarrhythmias, or severe ventricular dysfunction, or severe renal and hepatic impairments. This drug is contraindicated. Now we'll move on to the third topic, sir, Remimezolam.
Yeah, you complete all the three. I'll then we'll discuss that.
Remimezolam is a ultra short-acting benzodiazepine, which is developed to combine the safety features of diazepine with the rapid onset and offset of the propofol. It is a ester-linked analog of midazolam. Mechanism of action, it acts on GABA A receptor complex at benzodiazepine binding site. It enhances the GABA effect, increases the chloride ion influx, causes hyperpolarization, which leads to sedation, hypnosis, anxiolysis, and amnesia. The unique feature of this Remimezolam, it is rapidly hydroxylized by tissue carboxylesterase into inactive metabolite. Therefore, the contact sensitivity half time of this Remimezolam is about 7 minutes. The duration is unaffected by infusion length. Pharmacokinetics, onset of action is 1 to 2 minutes. Peak effect is on 3 to 4 minutes. Elimination half-life is 5 to 10 minutes. Metabolism is organ independent esterases. Excretion by renal as an inactivated metabolite. It can be also fully reversed by flumazenil. Dosages for the induction, infusion of 6 to 12 mg per kg RR until LOC is obtained. Maintenance 1 to 2 mg per kg per hour Procedural sedation 5 mg IV over 1 minute and repeat 2.5 mg as needed. Advantages: it has rapid onset and very fast recovery. It has a predictable recovery even after long infusion. There is no and hemodynamically stable. There is a minimal fall in BP and heart rate. Respiratory depression is mild and it is a dose dependent. It is also fully reversible with flumazenil. There is no pain on injection. Safe in hepatic and renal impairment. Adverse effect: it has side effects. It causes mild hypotension, dose dependent respiratory depression, dizziness, and euphoria post sedation. Clinically, it uses in induction and maintenance of general anesthesia, procedural sedation, ICU sedation, daycare surgeries with rapid recoveries needed. That's all, sir.
Right. Okay. So all the points have been covered except that the presentation of the available concentration that also has to be included in there.
Okay, sir.
Sugammadex, what is the available vial? How much is there in each vial? What are the various percentages we have? Similarly,
Sir, 1 ml contain 50 mg. What we are using is 1 ml contain 50 mg, sir.
so it comes in 2 ml and 5 ml vials. Okay,
Okay,
it
sir.
can be 100 milligram or 250 milligram depending upon the requirement. Especially when you use 16 milligram, you require a larger dose. So for that, they are marketing it as a 5 ml vial also. That also contains 50 milligram per ml. So you can use that vial for immediate reversal if you do it after that. If you can't intubate after the rapid induction dose, rapid sequence induction, you can use the larger 16 milligram dose also. Okay? And with Levosimendon, it is more indicated in the right heart failure, where
Yes, sir.
the right ventricular pain is more. So that is the point that you can improve. Is there any contraindication in using calcium channel blockers when the patient is on Levosimendon?
Calcium channel blocker, sir.
Because you said it will augment the contraction by attaching itself to the troponin C. Calcium and
Yes,
it will not alter the cytoplasmic
no, sir.
calcium level.
There is no. We can use calcium channel blocker, sir, because Levosimendon is a
Suppose the
calcium
patient is
sensitive
on
as well, sir.
nifedipine or clenipine, is it advisable to use Levosimendon in that patient?
Yes, sir. We can use, sir.
The relative contraindication.
Yes, sir.
Just see the slide and that is also available in 2 strengths. What are the strengths in which Levosimendon is available?
Don't know, sir.
It's available as 2.5 milligram vial and 12.5 milligram vial. So it is also available in 2 strengths. And of course, Remimezolam contains the pharmacokinetics and dynamics of. So it is mainly metabolized by the esterases in the liver. Okay, just like your remifentanil, which is also metabolized by the esterases. That is the reason why it has been given the name Remimezolam, because Remi is a part of remifentanil name. Even though it doesn't have analgesic property like remifentanil, the reason the name has been given is because the pharmacokinetic action, where the esterases are the ones which metabolize these drugs. Okay? So that is also comes in the, what is the commercial brand name for Remimezolam?
No, it is. No, it is, sir.
Okay. Right. Just show you the